Hi, this is Dr. Johnson, and today we will be discussing selective mutism. So, selective mutism is a relatively rare disorder, less than 1% of the population from research shows, but also it's primarily at a younger age group, pre-K-ish age. When you think about selective mutism, even in my experience, I've only seen it in one case. It is definitely does not come up very much, but it's good to know because whether it's this diagnosis or maybe social anxiety disorder, you try to diagnose for best fit, especially as a mental health professional. But if you're in the school system, this can also guide treatment. The elements of selective mutism is not speaking it typically in one environment and going back to that anxiety piece because this does fall under anxiety umbrella. It is a way of behavior mechanism to cope. So many times the individual or the student, I would say in this case, may be speaking at home just fine, but then at school they may not speak, or they might speak to peers, but maybe teachers or vice versa. My one case that I've had, they would not speak to peers and they would not really speak at school. So it there's different treatment approaches for this. So this relies about age 7 or up. CBT is quite common, but when you're got the younger ages, consider using different shaping reinforcement or positive reinforcement, encouraging them to talk. But also another good one for this is self-modeling, where if they're speaking at home, they could be recorded and they almost watch themselves in the session talk about it. Because typically, like in my one case, they did not speak at all. So this sometimes throws counselors for a loop because we're used to some form of communication or some behaviors. So consider also how this can get reinforced. Let's give the parent example, or maybe even a teaching example. These symptoms can be extended by someone talking for them or doing doing the activities for them instead of allowing them to use their voice. Another intervention that could be used is systematic desensitization, and this could be used in different ways, such as if they're comfortable in the house, introducing new people at the house slowly, gradually. The last thing you want to do is increase symptoms, especially the non-communication, because it goes back to that anxiety, getting overwhelmed, even where they were typically comfortable. For example, in this example, the home environment. As with any as with any disorder we've been talking about in class, always consider the different factors, but also be sensitive to the unique behaviors and what they're trying to communicate. I hope you enjoyed this video on selective mutism, and I look forward to the discussions in class. Thank you.